Smoking and mental health. Cigarettes are the creator of voids. They do not fill the voids in our lives. People are aware of the physical health risks of smoking, but researches have also shown that smoking also affects mental health too. If a person already has mental health problems, smoking makes it more complicated. People think that smoking can help to reduce stress, depression, and also helps to fight with a bad mood. Smoking and addiction. The biological factors involved in smoking relate to how the brain responds to nicotine. When a person smokes, a dose of nicotine reaches the brain within 10 seconds. At first, nicotine improves mood and concentration, decreases anger and stress, relaxes muscles, and reduces appetite. Regular doses of nicotine lead to changes in the brain, which then lead to nicotine withdrawal symptoms when the supply of nicotine decreases. Smoking temporarily reduces these withdrawal symptoms and can therefore reinforce the habit. This cycle is how most smokers become nicotine dependent. Social and psychological factors also play a part in keeping smokers smoking. Although many young people experiment with cigarettes, other factors influence whether someone will go on to become a regular smoker. These include having friends or relatives who smoke and their parents' attitude to smoking. As young people become adults, they are more likely to smoke if they misuse alcohol or drugs or live in poverty. These factors make it more likely that someone will encounter stress. Most adults say that they smoke because of habit or routine and/or because it helps them relax and cope with stress. The relation between smoking, anxiety, and moods. Smoking is one of the main reasons for anxiety and a bad mood. Most smokers say they want to stop, but some continue because smoking seems to relieve stress and anxiety. It's a common belief that smoking helps you relax. But smoking increases anxiety and tension. Smokers are also more likely than non-smokers to develop depression over time. Smoking and depression. In the UK, smoking rates among adults with depression are about twice as high as among adults without depression. People with depression have particular difficulty when they try to stop smoking and have more severe withdrawal symptoms during attempts to give up. Nicotine stimulates the release of the chemical dopamine in the brain. Dopamine is involved in triggering positive feelings. It is often found to be low in people with depression, who may then use cigarettes as a way of temporarily increasing their dopamine supply. However, smoking encourages the brain to switch off its mechanism for making dopamine, so in the long term the supply decreases, which in turn prompts people to smoke more. Most people start to smoke before they show signs of depression, so it is unclear whether smoking leads to depression or depression encourages people to start smoking. The most likely explanation is that there is a complex relationship between the two. Smoking and schizophrenia. People with schizophrenia are 3 times more likely to smoke than other people, and they tend to smoke more heavily. One of the most common explanations of this is that people with schizophrenia use smoking to control or manage some of the symptoms associated with their illness and to reduce some of the side effects of their medication. A recent study has shown that there could be a causal link between smoking and schizophrenia. However, various factors may increase the risk for developing schizophrenia, and further research is needed to fully understand the link and causal pathway. Ways to help you quit. Stopping smoking suddenly through willpower alone, going cold turkey, is the least effective way to quit. Stopping is more likely to be successful if you plan, have support, and choose the right time to try. Your attempt is less likely to work if you are feeling unstable, experiencing a crisis, or undergoing significant changes in your life. To prepare for change, think about your relationship with smoking. Understanding the effect that it has on you can boost your motivation to quit. Think about what you will gain by not smoking, for instance, better physical health, fresher breath, improved concentration, and more money in your pocket to spend on other things. You may find it helpful to write this down as a reminder of why you want to stop. Finding other ways to cope with stress. Because smoking is often used as a way of coping, smokers need other ways of dealing with stress, anxiety, or other problems if they want to stop smoking. Methods that people have found helpful include meditation and breathing exercises, regular exercise, cutting down on alcohol, eating a well-balanced diet, acupuncture, and clinical hypnosis. Counseling or talking things through with a supportive friend or family member and religious or spiritual activities can also help. Making changes takes time and effort. Progress is often slow. Be patient. You may not be able to control all the factors that contribute to your stress, but identifying the source of your anxiety and trying to find ways to reduce or overcome it are as important as finding new ways to cope with it. Getting support from family and friends. Stopping smoking can be easier if you talk about it to family and friends and let them support you. If other people who live with you smoke, it may be harder for you to give up. You could try to get other household members who smoke, or friends who smoke, to stop smoking at the same time. At the least, encourage them not to smoke around you or leave their cigarettes, ashtrays, or lighters where you will see them. Avoiding triggers linked to smoking. The mind is very sensitive to associations, so removing all tobacco products from your home can help lessen some of the cravings of nicotine withdrawal. Smokers are accustomed to smoking in certain situations like in the pub or after a meal. If you can identify your trigger situations and avoid them, the chances of relapse will be much lower. Being prepared for withdrawal symptoms. Likely withdrawal symptoms include headaches, nausea, irritability, anxiety, craving cigarettes, feeling miserable, difficulty concentrating, increased appetite, and drowsiness. Drinking more fresh fruit juice or water, eating more high-fiber foods, and reducing the caffeine and refined sugar in your diet all help some people cope with withdrawal symptoms. Talking therapies. The individual, group, or telephone counseling can help people to stop smoking. Talking therapies can help people change their behavior by thinking and acting more positively. Many counseling programs use the techniques of cognitive behavioral therapy, CBT, and social skills development. Research has shown that CBT may be particularly effective in smokers with or without mental health problems.